The other thing you said that really touched me here is how through your therapy, you were able to find hope.
Mhm.
Can you talk about that a little bit?
Yeah. There were so many things that I felt hopeless about. I think that was a really common theme when I was struggling with depression, was just that hopelessness that I would ever be able to recover, that I would ever be able to be stable. There was hopelessness around whether I deserved to be happy. There was so much going on, and it really was like an all-consuming experience and really challenging to navigate, because when you're going through your day and you're trying to almost deal with this really heavy and overwhelming mood, a lot of the times we're like, okay, well, like tomorrow I'll feel better, or in a couple of hours I'm doing this thing that will make me feel better. And when you don't have that belief that the feeling will go away, and you don't have these things you're looking forward to, and everything kind of just becomes numb, that hope is really absent, and it can be really difficult to stay motivated and stay encouraged and even know what you're working towards. And I feel like that can be a somewhat common experience for teens that are really struggling with their mental health, where they're like, I don't remember a time that this felt different, and so I don't know what I'm working towards. And so when you hear the idea of like, well, you'll get better or things will change, because you don't have that immediately like front of mind, like, oh, I felt that this morning, like, yes, I'm going to get back to that point. It's really discouraging, and it becomes really challenging to feel that hope and have that continued motivation. There were a couple of things that shifted that for me. One was, like we talked about, being able to cope with emotions and effectively cope with emotions. Just knowing that I've done this before and I can do it again. And every day being able to like build mastery over coping with depression or coping with anxiety or coping with fear or shame or the anxiety that comes with being vulnerable. Knowing that I had those skills in my toolbox, and that no matter what emotion arose, I would be able to handle that emotion and cope with it, and even just experiencing it without it being distressing, which was a whole new thing.
Which means living.
Yes, exactly, exactly. And then the other things that really helped increase hope throughout that experience was having that initial shift of like waking up in the morning and not immediately feeling depressed. I remember that was like the craziest thing, where I was like, wait, what's going on?
Wow.
And then realizing that it was possible. And in those small moments, really latching onto that and being like, okay, what people said was true, that this feeling will shift, this emotion will shift, these thoughts are changing with time. And then another thing that probably won't be universally true, but I found a lot of hope in looking at the data, especially around DBT, and then in this context, CBT. I'm a very logical person. I'm very type A, and so knowing like this works for what I'm struggling with, and that I would be the outlier if this didn't work, that was very encouraging, because it was challenging to have faith in this thing and dedicate time. I mean, I wasn't in high school at that point. I was living on the other side of the country. I was in a mental hospital. And so there's a lot of things that were very overwhelming. So to know like this works, and if I stick to it and give my all, there's a really good chance that this outcome will be what I'm looking for.
You know, I started in this field way back when, and my professor at the time, Matt Jaremko, one of the first things he did was talk to us about hope. That if we are coming to this field with just thinking about seeing clients without understanding that folks are coming in who have lost hope or never even understood hope, that we shouldn't be in this, because it is about hope being one of the main mechanisms of change.
Exactly. It's like hope is the precursor for motivation. I think a lot of people are like, well, you just got to keep going. And it's like, you can't keep going because there's no motivation to even do that. You want to do anything but keep going because it's so painful. And so without having hope, it's really difficult to build that consistency, and it has to be established very early on in whatever way that means for you, whether it's being able to resist an urge or cope with a certain emotion that brings up a lot of fear and avoidance, or see the evidence that this will work. And if you don't, it's really challenging to continue on the path that you're on.
Yeah, well, I think a lot of what you're doing with social media and the different talks that you give and such is so important, because it is important for young people to see you so that they too can see themselves in you
Yeah.
and have hope and know that if they put their mind to it and give themselves over to working
Yeah.
with someone, they could make some
Yeah.
change for their lives for the better.
Yeah, I hope so, because I remember just really struggling to find hope in adults saying it will get better, because one of the things that was so challenging for you is the lack of autonomy. It was like,
Yeah.
well, I can't make decisions and I don't decide where I go to school or who's in my life or what my parents do. It really felt like there was a lack of agency. And obviously, after a lot of treatment and therapy, I know that's not necessarily true. And we have a lot of power over our thoughts and our emotions and how we cope with things. But when it feels like life is happening to you, it's really difficult to then be able to have hope that you can shift the emotions, shift the things that you're experiencing, and navigate that experience as a whole, especially when adults are telling you that from a different position. That was something that was difficult to navigate, but so that's the hope, is that teens can hear from another teen that it is possible to recover. Because as great as group therapy is to be in it together, you're also in it together. You're not in group therapy with someone that's years out of it and used to be in the position you
That's
are.
right.
And so it can be challenging to find that hope sometimes when you're kind of surrounded by it in your own experience and then also in others' experiences. And there's not necessarily someone that's there to say, I've done this before and I was exactly your age and your position and all those things.